All right, so we've just wrapped up our deep dive into the world of micronutrients, all those tiny vitamins and minerals that are so critical for our health. Now, we're going to zoom all the way out and look at a huge public health issue where nutrition is absolutely front and center, the obesity epidemic. The numbers here are pretty staggering, so let's just jump right in.
So what do you think of when you see this number, 40.3%? It's not just some random statistic. It's the percentage of American adults who are projected to have obesity in 2026. That's literally 2 out of every 5 adults. Let's unpack how we even got to this point.
Okay, before we get into the weeds with the data, we got to get 2 key terms straight: overweight and obesity. People use them interchangeably all the time, but they're not the same thing. Being overweight could just mean you have extra weight from muscle or bone, like a bodybuilder. But obesity, that's what we're focused on here. That specifically means having an excessive and unhealthy amount of body fat, and that's what carries all these serious health risks. So how in the world did we get to a place where 2 in 5 adults have obesity? Well, the data tells a really fascinating and, frankly, a pretty troubling story. Let's take a look. This table really shows you the shift. In just over 25 years, the overall obesity rate jumped from about 30% to over 40%. That's a huge increase. But the really shocking story is in that second row. Severe obesity has more than doubled. It went from just under 5% to almost 10%. And this is the category where the health risks are the most extreme. Just to really let that sink in, the rate of severe obesity, which is the highest risk group, has more than doubled. This isn't just a tiny, gradual increase. We're talking about a massive public health shift, and honestly, it's the most alarming part of this whole trend. You look at a chart like that, and it's easy to think this is just some unstoppable train that's picking up speed. But is that actually what's happening right now? Well, the story gets a little more complicated.
So interestingly enough, that relentless climb has actually started to level off a bit. Some experts are calling it the plateau effect. The rate actually hit its peak back in 2018 at 42.4% and has come down just a little since then. It's a small glimmer of hope, but what's going on here? Well, a huge piece of the puzzle is a new class of medications you've probably heard about, the GLP-1 agonists. These drugs were first developed for diabetes, but they have a really powerful effect on weight loss. Their widespread use in just the last few years has been a total game changer, and for the first time, we're actually seeing it move the needle on a national scale. But here's something that's really important to understand. This national average, it hides a much more complex truth. The burden of obesity is not shared equally. The data is crystal clear that rates are consistently higher among non-Hispanic Black and Hispanic Americans. This points to some really deep-seated issues around health equity and socioeconomic factors.
And this isn't just an issue for adults. The trends we're seeing in young people are just as concerning. Right now, 1 in 5 children and adolescents in the United States has obesity. That has incredibly serious implications for our future.
And here is exactly why that 1 in 5 statistic is so scary. It's not something most kids just grow out of. The data shows that childhood obesity is a very, very strong predictor of adult obesity. So what we're looking at isn't just a problem for today. We're looking at a public health challenge that's going to ripple out for generations.
Okay, so we've looked at the numbers, but what does it all really mean for a person's health? What is the actual burden that this places on the human body? Let's dive into the pretty serious health consequences.
So what exactly are we talking about when we say health risks? What happens to the body when it's carrying excessive and unhealthy amounts of fat? Well, the list is long, and it affects pretty much every single system in the body. So let's start with the big ones, the cardiometabolic risks. You've definitely heard of these: type 2 diabetes, heart disease, stroke, high blood pressure. And the real driver behind many of these is something called insulin resistance. That's when your body cells basically start ignoring the hormone insulin, which leads to dangerously high blood sugar. But the risks don't stop there, not even close. Obesity is also linked to a higher risk for certain cancers, to fatty liver disease, and even to dementia. A lot of these problems are triggered by what's called hyperinsulinemia, which is just a state of having chronically high insulin levels because your body is trying so hard to overcome that insulin resistance. All that hormonal stress just takes a massive toll on the whole system. Let's look at a really specific example of a hormonal consequence, polycystic ovarian syndrome, or PCOS. This is a super common disorder in women with obesity, and it's tied directly to that insulin resistance we've been talking about. It can completely throw off menstrual cycles, alter hormone levels, and it's actually a leading cause of infertility. It's just a crystal clear example of how obesity can have these profound, life-altering effects. You know, the burden of obesity isn't just physical. The consequences run much, much deeper, affecting a person's social life and their psychological well-being. And honestly, this is an aspect that gets ignored way too often. People with obesity often have to deal with social stigma and outright discrimination. This can lead to really serious mental health challenges like depression or disordered eating. And then there's the huge financial cost for both the person and our entire healthcare system. It's just a heavy burden to carry in every single sense of the word. And all of this brings us to our final and maybe the most critical point we're going to make. We absolutely have to reframe how we think about this condition. We need to move away from these really outdated and harmful ideas. I just want you to read this quote for a second. Too many people think obesity is the result of lacking willpower or self-control. This is a myth that is so pervasive in our culture, this idea that it's just a simple failure of individual choice. But the science tells us a much, much more complicated story. The reality is that obesity is a complex medical condition. It is not a moral failing. It's shaped by this incredible web of factors. Things like public policy that decides what food is in our schools, a food system that often values profit way more than health, our built environments that can make it hard to be active, and all sorts of psychosocial factors like stress and trauma. It's a societal problem, and it's going to require a societal solution.
So I want to leave you with this question to chew on. If we accept that obesity isn't a moral failing, that it's a complex medical condition, then how should we be measuring it? Is a simple scale of just height and weight really enough to capture all that complexity? And that, my friends, is the perfect question to lead us right into our next topic, body mass index.